in accordance with laws and regulations and the basic life and the medical needs of the general public can be met. To combat the pandemic, we need a social fabric of defense. We appeal the general public to be the first person accountable for their health and have good health habits. Today we will focus on the theme that time waits for no one. We must consolidate and refine our control measures. We have with us DDG Liu Peijun from the Sports, Health and Arts Department of Ministry of Education, Mr. Lei Zhenglong, DDG from the Disease Control Bureau of the National Health Commission, Chief Immunization Planner Mr. Wang Huaqing from CDC, and also from China CDC, the Chief Expert on Disinfection Studies, Mr. Zhang Liubo. They will jointly take your questions. Now the floor is open for questions. Please raise your hands if you have questions, and please identify yourself before you ask your questions. Thank you. With the Xinhua News Agency, as the moderator has mentioned, daily new confirmed local cases and symptomatic infection numbers have been on continuous decline. What has been the major changes of the pandemic situation in the past few days? I'd like to invite Mr. Lei Zhenglong to take the question. Thank you for your question. In the past several days, the case number has been on continuous stable decline over the past several days, with the daily new confirmed cases decreased to below 600 and below 500 in Shanghai for the past 4 days. The situation is stabilized and towards the better. However, in Shanghai, the situation is still relatively risky. We should be aware of the potential rebounding in some places of risk. In Beijing, newly reported infection number has been on substantial decline in the past 2 days. However, in the district of Fengtai and Haidian, we are still finding community transmission, community infected cases. There is a risk of community transmission in Jilin province. There had been some local cases reported in the border counties with unknown sources. And there is the potential of the transmission from the border areas to inland areas. There is the spilling over risk. And in Tianjin, there are multiple points of cluster cases. Community transmission risk remains. In Guang'an, Lingshui of Sichuan province, the pandemic is tailing off. For several days, there has been no infection reported from the non-controlled areas. In Henan, situations is stabilized, and in the city of Zhengzhou, there is no community transmission. There are still some small scale of cases in Xuchang of Henan province. At present, we are still faced with the ongoing pressure of preventing imported cases or domestic rebounding. National Health Commission will continue to guide localities to implement 4 early outbreak control capacity, improve the efficiency of response, consolidate the four-party accountability, and implement control measures in places, people, and organizations at risks, have scientific and targeted measures, and resolutely prevent oversimplification of one-size-fits-all approach. And we will make a holistic balance between the pandemic control and socio-economic development. Thank you. With CRN, we know that the vaccine targeted at Omicron is in the clinical trial phase. To have a better immunization efficacy, do you suggest that the general public can wait until the Omicron vaccine is adopted before they take the second dose or the booster dose? I'd like to invite Mr. Wang Huaqing to take the question. Thank you for your question. The variant Omicron has led to the fact that the COVID-19 is transmitting more quickly with a higher transmissibility, while the transmission is stealth and exacerbating the risk of infection. Against this backdrop, we are seeing that COVID-19 vaccine has proven effects over preventing severe cases or even death. Such efficacy has been clear and substantial. If you have got the full course vaccination, in particular booster dose, this efficacy has been proven more effective. The study on Omicron-targeted vaccine is aimed at adding one more tool to our toolkit of responding to the pandemic. Though the vaccine Omicron variant is already in the phase of clinical trial, we still need time to determine on the final conclusion of the research. The virus is still evolving with certain uncertainty. The rapid and rampant prevalence of Omicron in certain countries have added uncertainties. Against this backdrop, if the population do not get vaccination for the full course vaccination or booster vaccination as soon as quickly, in particular the elderly and the people with underlying chronic diseases, they are exposed to greater risk. Hypothetically, if the elderly population and the people with underlying diseases, once infected, are more prone to be developed into the severe cases, which may overwhelm the health resources. Therefore, it is the imperative to get a full course vaccination as quickly as possible. This has been proven effective to prevent the severe cases or death. Thank you.
好，谢谢，请继续提问。好，
Thank
现
you.
在
Next
请
question,
左侧区第
please.
4排，第2位穿黑色衣服的男记者。
好，谢谢发言人。21世纪经济报道记者
With the 21st century economic news,
群众按照规定减少流动，
in
相应的对于
the
快递的需求量
pandemic
就在增
affected
加。请问
regions,
在快递在仓储、运
the
输以及
people
送达
are
环节中
staying
应当
put.
如何做好消毒？
Therefore, there is
那
a
么
natural
群众个
increase
人
of the
在
need
收取快
for
递
the
时
faster
应当如何做好
delivery
消毒以及个人
couriers.
的防护？谢谢。
And how do you disinfect the packages during warehousing, logistics, and delivery? And how can the general public be better protected when they receive the delivered packages? Mr. Zhang Liubo is taking the question. In the pandemic-affected regions, when people stay put, they will have a natural increased need of the delivery. The State Post Bureau has dedicated operation guidelines. It stipulates that there must be a zoned and risk-rated prevention control measures, including the disinfection requirement for the packages in warehousing, logistics, and at the points of delivery. For the general public, the key for their protection is the way of disposal when they receive the delivered packages. We have several points of suggestions. First, the general public is advised to avoid contamination. Therefore, we recommend the general public to buy from regions of low risk. There is a technical difficulty of disinfecting the items inside the package. Therefore, the populace is recommended to purchase from the low-risk region. Second, better select a contactless way of receiving the package and have appropriate protection by wearing masks and gloves and keeping social distance of about 1 meter with others. Apart from all these measures, the outer package should refrain from being taken indoor. If you have to take the exterior package indoor, you should use a sanitizer tissue to wipe all 6 dimensions in the box or spray. Disinfection.
What is more important is that after you handle these goods, you need to do a better job in the sanitization, for example, by washing the hands with sanitizer or soap. Thank you for the question.
谢谢南方都市报记者。想问一下教育部的刘司长，现在
I want to ask Mr. Liu from MOE. We know that in some regions there are still the resurgence of the cases. What are the priorities in the campus COVID response? Thank you for Nanfang Metropolitan newspaper and for your concern of the campus COVID response. In order to have accurate and scientific response to the complexities of the COVID response and to safeguard the health and the campus safety, MOE has fully implemented the strategic deployment of the national COVID control, and we have held many times of video meetings so as to better implement all kinds of national policies in the educational system. We have issued the documents so as to give the guidance to the campus COVID response in the five following measures. First of all, that is the stringent implementation of the ongoing COVID responses. The four parties' responsibility should be implemented. We should enhance the entrance management, health monitoring, the management in the priority areas, including the dormitories, dining halls, as well as health monitoring. We should also enhance the health awareness and training for the staff and the students, and we should also conduct the NAT testing and strengthen the emergency responses. And secondly, we should make a good preparation of the emergency disposal of the sporadic sudden outbreaks, so the four early principle should be adopted. Once there is an outbreak of the cases, the emergency mechanism should be triggered, and it should be made sure that those who should be tested, quarantined, hospitalized, and treated, and all those epidemiological and transfer quarantine should be conducted. Those people who should leave campus should be transferred to the quarantined areas, and etc. And thirdly, the service guarantee should be adopted within the campus, so the requirements of all the staff and the students should have the accessibility to the medical facilities, and the prices of the commodities and the dining within the campus should be maintained at a reasonable level, and an orderly learning and working environment should be created. And fourthly, we should enhance the human touch to the teachers and the students, the leaders within the campus and the mentors, the head teachers should go into the dormitories of the students to know better of the needs of the faculties and the teachers so as to resolve any difficulties that they are facing. And fifthly, to enhance the service capabilities of the schools, we should enhance the building, capacity building of the clinics of the middle and the primary schools and the higher learning institutions. Especially for the higher learning institutions, they should set up the quarantine buffer area and the rooms, so that such rooms should be set up, and they can have a linking mechanism with the designated hospitals nearby, and these should lay a very good foundation for the COVID response for the higher learning institutions.
中央广播电视总台央视记者提问：近期呢，一些地方对病例居住或者活动过的地方进行了终末消毒，但是有些地方在执行的过程中呢，加码到了
disinfection on where the source domiciled, and some localities has imposed a very draconian disinfection. Whenever there is one positive case, the whole building would have to be disinfected by entering into the house manner, which has roused controversies. Do you think it is really very reasonable? Thank you for your question. Disinfection is the effective methods and means to conduct the people, object, and the environment, which has been proved very effective to cut off the transmission. And according to the infectious disease prevention law, it has been required that such venues and objects should be disinfected. And NHC, after the outbreak of the COVID-19, has issued all kinds of documents on how the infection should be better conducted, and all the related authorities and industries have conducted their own monitoring on the disinfection. During the course of the COVID-19 response. So all the localities has organized professional disinfection teams based on the laws and according to the containment measures of COVID and according to the results of the epidemiological investigation have conducted such disinfections to the domicile where the sources has been lived, which has played a very important role. However, we have noted that in some places there are the issues still remain, which mainly caused by the lack of communication and improper operation. So there is a strong need for us to better conduct the trainings on the methods of disinfection and the technical operation, as well as having a better monitoring of the disinfection processes. When organizing such disinfection entering into the home, such technical processes should be conducted according to the protocols. So such anti and post communication should be better conducted so as to gain the support of the mass public.
每日经济新闻宏观频道记者提问：有说法认为，奥密克戎感染后就会获得天然的免疫，这种说法有道理吗？对于感染奥密克戎后获得的免疫，和接种疫苗后产生的免疫效果，第二者有什么区别？谢谢。
What is the difference between the immunity that is acquired after being infected by Omicron and being vaccinated? Thank you for your question. The COVID is still varying and evolving constantly. For such a prevalent Omicron, it is also under an evolving process. We are gaining a better understanding with its dynamic changes. Theoretically, indeed, there will be a natural immunity after being infected. However, we don't think it is the choice by us right now because on the one hand, we know that the variant will cause death and severe diseases, especially for the senior and those with underlying diseases. I believe it is really a very dangerous choice because we have already seen that it really happens as I have described. Secondly, after the application of the vaccination, it has a very dramatic effect and obvious effect in reacting to the severe and the deaths. And other than that, we have seen the variations on the Omicron, so the immunity that has been deduced by the natural infection is really quite uncertain because there is no way for us to be quite certain on the level of the immunity based on the natural infection. The very recent two researches which is published on the two leading medical journals, Nature and New England, have fully shown that the outcome of the researches is that the Omicron variant, after being naturally infected, the antibody level is lower than that of the antibody level of those being vaccinated. And secondly, because of the variants of the Omicron, the diversity of the immunity is not really covering a wider area with the antibody that has been induced by the vaccination. So it is fair to say that such a natural immunity has a limited protection against other variants.
Thank you. Next question, please.
第二排第三位女记者。
总台央视中文国际频道记者。
With
那我们知道新冠
CGTN,
肺炎疫情消毒技术指南规定，在病例或无症状感染者住院后，
COVID-19 disinfection technology guideline has stipulated that there should be domicile disinfection after the case leaves his domicile. However, recent studies have shown there is only a very small likelihood of infection because of the contact of objects, and this has triggered some disputes. Is in-house or the domicile disinfection necessary? Why is it necessary? If yes, Mr. Zhang Liubo is taking the question. This is a great question. It is also a question needs our attention as the prevention control technologies have been evolving. Just now, DDG Mr. Lei Zhenglong has already shared with us the necessity of domicile disinfection. I'd like to approach your question from the technological perspective. When the case is quarantined, we should prevent the transmission of object to human or environment to human transmission. As to how should we disinfect the objects or the domicile, I think after the case or the asymptomatic cases have left a certain place, there have been the contamination on the objects they've touched and the environment they've lived in. On the surfaces of these objects, there might be the existence of live virus. Before we use these objects, we need to have the thorough disinfection. Sometimes it's difficult to judge the viability of the virus. It is time-bound. Besides, it also has something to do with the viral load, the ambient temperature, the humidity, the load and intensity of the contaminated objects, and the sunshine, the intensity of the sunshine on the surfaces of the objects. Therefore, we need to consider all these elements to come to a scientific conclusion. After the domicile or object thorough disinfection, we must ensure all the virus on the surfaces of the objects or in the domicile environment must be thoroughly disinfected. Domicile disinfection is the measure we've adopted to prevent the transmission among the family households where there has been some cases, but we should note that while we have the domicile disinfection, we must let the family members to stay out and only come in after the disinfection is completed. The team members of the disinfection team should be protected with personal protection equipment. For different textiles of the objects, different ways of disinfection should be adopted to prevent potential damage on the disinfected objects, including the valuable ones. And for the objects that have never been touched by the cases or asymptomatic cases, we can seal them in a certain container to de-hazardous object. But this sealing method should be combined with other disinfection measures and other protection measures to ensure its effectiveness. Thank you. Next question, please. With the Phoenix TV, we've noticed such discussion online. Some people developed leukemia after vaccination of the COVID-19 vaccine, so they believe there might be some relevance between leukemia and vaccination. Does this opinion hold water? Mr. Wang Huaqing is taking the question. Is there a relevance between vaccination and the development of certain disease? To answer this question, we should first answer if the standardization of the vaccination is in place and whether vaccination process has been standardized. If there is the doubt that certain disease is related to vaccination, then such a suspicion must be reported to the vaccinating agency. There should be the establishment of an investigative diagnostic experts panel established to look into the matter. In the investigation process, relevant materials and files must be collected, including the vaccinee's status, his or her past case history, disease history. We need to collect enormous data from the past record. Third, if we want to answer the question related to any anomaly reaction, we need to set up an experts panel composed of multidisciplinary experts to conduct analysis on the data collected and come to a conclusion. And this should also be judged based on the finding results from the investigative team. We pay attention to several relevance. First is the time causal effect. That is, vaccination should be prior to the development of the disease. Second, we have to answer whether it is biologically reasonable. For example, in principle, attenuated vaccine should not be used and administered on people with immunodeficiency, because in terms of the biological feature, attenuated vaccine may lead to a higher risk of anomaly reaction among people with immunodeficiency. The second thing we should pay attention to is the intensity of the relevance. That means we need a statistically meaningful difference with a substantial difference. So that is the intensity of the relevance. Besides, the fourth question we need to answer is to see if there is any pattern of the occurrence of a side effect or anomaly reaction. That is the dose-reaction relation, which means that the higher dose is, the stronger the response is. That indicates the existence of a dose-reaction relation. The fifth item we need to consider is the consistency in the relevance. This is a rather specialized knowledge, but we can put it simply in this way. That is, do all these people who get vaccinated have shown consistency in the development of a certain symptom or disease? Those with or without the vaccination may develop such a symptom, but we need to observe whether those with vaccination have shown a consistently stronger development of the symptom. And the specificity of the relevance is another thing we should pay attention to. We know certain side effect of the BCG vaccine for people with immunodeficiency. Those with the BCG vaccination may easily develop certain TB symptoms. That is the specificity of the relevance between the vaccine and an anomaly reaction, which means that the vaccine was the only reason leading to such incidents. All in all, we want to emphasize that if you have find anomaly reaction, or you are feeling great discomfort after vaccination, which lasted for a relatively long period, or if you have the suspicion that these symptoms or disease have something to do with the vaccine, you are advised to go to hospitals to seek medical advice and timely inform reform the local health department of CDCs because we need a whole panel of multidisciplinary experts to make investigation and come to a conclusion.
Because anomalies is still something that we need to gain more knowledge on, and we need to have a better understanding of it. So it depends on the judgment of the multidisciplinary professional panels to make a professional judgment.
现在请这区第3排考核到第1位记者。
谢谢主持人。澎湃新闻记者提问，我的问题
Thank you
是
from
向张刘波
Bloomberg.
主任提出
I
的。
have
那我
a
们都知道，
question
多数
for
消
Zhang
毒剂
Liubo.
是
As
具
we
有很
know
强的
that
刺激
most
性，
of the
像刺激我们的
disinfectant
眼睛和喉
is
咙的话。
rather
那么对于
irritating,
这方
for
面，我们应
example,
该如何防
irritating
范，
the
避免消
eyes
毒剂给
and
人体带来的
causing
一些伤
the
害？
endema and
谢谢这位
sneezes
记
and
者
coughs
的
and
提问。
etc. How
因为
can we
这个
avoid the harm of
这
the
个问题啊，也
disinfectant
是这
to
几年经
people's
常
health?
可以问
Thank
到
you
的
for
一
your
个
question. This is
消毒
really
技术
a
问题。
question
但是
which
我
is
还是愿
really
意多
quite
讲几句
technical concerning
来
about
继续
the
的宣传
disinfection. I
咱们
really
怎么
want to
来
say a little bit
避
more
免
and
因
how
为
to
消
avoid
毒的问
such
题带来
health
的健康风
risks
险。我
based
想
on
第一
the
个，我们应
disinfectant.
该
First
是
of all,
避
we
免
need to
盲目的
avoid
消毒
the blindfold
过度的消毒
disinfection and
我
excessive
们消毒应该是要有
disinfection.
针对性，
Disinfection should be
只是
targeted
在通过
only
消毒
when we know
能够
that
切断
through
传播途径的时
disinfection
候
can we cut
才有
off the
必要实施。
transmission routes.
同
There is
时
a
呢，
need for us to
如果
adopt
我
the
们有
disinfection.
多种
While
方
at the
法
same time,
可
if
以
we have
可以
multiple
实现
measures
阻断
to
传播的时候，
stem the
我们就
transmission,
可
we
以
can
选
choose
择
the
最安
safest
全
and the
有效的
reliable
方法，
and the
对
economic
经济
and
便捷的
convenient
方法。
methods.
消毒
Disinfection
应该
is
是可
only
以
one of
供选
the
择的方法之
alternative.
一。
Well,
第
one
二
of
个
the
呢，应
choices.
该要
And
确保
secondly, we need
消
to
毒
make
有
sure
效
that
的前提下，
the
尽
prerequisite
量
is
选
that
择
the disinfection
这
is
个安全性
effective.
好的
We
消毒
should
剂和
choose
消毒
the
方法。
disinfectant
这
which
里面
is
我就举个例
safer.
子
Let me give
需要
you
特
an
别说明一
example
下的。
which
像我
should
们
be
那个这
specifically
些消毒剂，它是不
illustrated
是
such
安全有
disinfection,
效？
whether they
不
are
只是消
safe
毒剂本
and
身，还
effective.
跟
It
你
is
的
not
使
only
用方法
related to
有
the
比较大的
disinfectant
关系。
itself, it is
像我
also
们
quite related
比
to
较
the
常
way
见的像
that it
降
is
盐
being
类消毒
used.
剂
For
和一
example,
些
the
其他的一些氧化类
thiamine
的消毒
and
剂，像过氧乙
also
酸钠、过氧化氢钠、
paracetic
含氯消
acid
毒剂
and
这一类的
hydrogen
问题。
peroxide
降盐
and
消毒剂
the
在做
chloride
茶室消毒的时候，
types of
浸泡消毒的时
disinfectant
候，
when
通
they
常
are
呢
being
安全性
used in a
比较
way
高。
of
但是
wiping
呢，
or a
你要把它
soaking
去做
manner,
喷
it
雾
is
消毒，
highly effective.
去
But
做
if it is
熏蒸
used
消毒，
in a
去做
spray
这些
or
消毒的时候，
aerosol
去做气雾消
manner
毒，去做
and
这些消毒的时
it
候，吸入进去了，
is
它
a
的
high
吸入的风险
possibility
吸
of
入带来的
a
安全风险
risky level
就比较
when
大。
it is
所以
inhaled.
呢，我
So
们需要针对不同
that
的
is
消
why
毒对
targeted
象
on
和消
different
毒方法来选
objects
择
of
消毒剂
disinfection
就非
and
常的重要。
the
那么
disinfectant
具
should
体
be
的消
chosen
毒剂的
on
选
a
择应该
rightful
可以
manner
参考2
and
年前，刚好2
disinfection
年
methods
2 年
should
前
also
联防
be
联
well
控机制
chosen.
曾经发布
And
过一
the
个
State
常用消
Council
毒剂使用指
Interagency
南，按照
Council
这个做，
has
仍然还是
issued
可以
around
的。
2 years ago
一
about
个
the
除
instructions
了
of
这以外呢，
the
第3个，我们消毒剂
disinfections
的使用浓
usages.
度
It should
也
be
不
used
是
as a
越
very
高
good
越好，
reference. And
使用
thirdly,
的
the
量也不
concentration
是
of the
越多越好。
disinfection
我们
doesn't
只要能够
necessarily
达到
mean
消
that
毒
the
效
higher
果
the better
就可以
and
了。
the more
因为
the
过大
better,
的
because
剂量
so long
会
as it
伴
can
随
achieve
安全风险。
effect,
那么
then
使
it is
用的时
better.
候，
The
我们应该是按照
overdosages
消
will
毒
go
剂的说
along
明
with
书
a
规
high
定的
level
用量
of safety
来使用。
risk. So according
第4
to
个，
the
在使用的时候
descriptions
要
of the
做好个人防
disinfections,
护。
it should be used
特别是
accordingly. And
我们可以
fourthly,
说
the
消毒的时
personal
候，
protection
我
should
们
be
无关的
better
人应该尽
conducted
量的
when
远
being
离这些消毒
infected.
操作的区
Those
域。
who are
我
not
们消毒
related
的
to the
工作人
operation
员
of
可以根
disinfection
据需
should
要
keep
来
arms
选择
away,
戴
and
手套、
the
戴口罩、
personnel should
戴护目
choose to
镜、
wear
穿防护
goggles,
服，
masks,
那
gloves,
个甚
and
至是
chemical
我们
protective
使
filters
用
and
防
etc.
化的这些过
So
滤器
even
等
such
等
very
这些装置
professional
来保证
devices
我们
should be
工作人员
used
的
to
安全。
protect
好，
the
谢谢。
safety of the personnel
好，谢谢，
when
请继续提问。
operating the disinfection
好，下
operations.
右社区第2排第2位穿深蓝色衣服的记者。
谢谢主持人，我是中国教育电视台记者。我们都知道当前疫情防控形势严峻复杂，所以想请问教育部在这种情况下，如何确保各地都能保证好、有效地做好我们的教育教学质量？
situation, how can we make sure that the educational quality can be well ensured, and how can we have a very good transition between the online and offline teaching? Thank you very much for the journalists for paying great attention to the teaching arrangement of online and offline, as well as the guarantee of the teaching quality. During the COVID-19 response, we should pay equal importance to the physical and mental health, as well as the academic progress of the students based on different types of COVID-19 responses. All the schools are flexibly switching their teaching methods both online and offline. There is a great guarantee to both the quality of teaching and learning, especially for ensuring the teaching quality of online. The MOE have set up such an online teaching quality mechanism. First of all, we need to roll out premium quality class resources. The MOE has accelerated its building of the National Smart Educational Public Service Platform and have rolled out a large number of premium courses. So we have built up such an online classroom accessible for all, and it can be learned at any time and anywhere. So we have fully utilized the cutting-edge technology to make sure that even though there is a suspension of the offline class, but teaching and learning are not suspended. Secondly, we need to have a highly efficient online interaction to ensure its quality. The school have optimized the online teaching methods and encouraging the students to conduct the online teaching, online discussion, online question answers to enhance the interactions between students and teachers to make sure the teaching quality is still highly guaranteed. And thirdly, we need to have very targeted teaching management to ensure the quality. MOE, along with other agencies, has issued the online management documents. So the main responsibility of the school has been identified to make sure that the online whole cycle quality management can be conducted. Currently, we are still facing a green COVID situation, so all the schools should take a very flexible attitude to have an orderly transition of the online teaching with the offline teaching to minimize the impact of the pandemic to the teaching quality. Recently, MOE has also issued the notice to enhance the transitions of the online and offline. First of all, such a decision-making mechanism should be optimized. All the educational administrative agencies should come out the guiding principles of the online and offline teaching transitions to make sure that for the offline teaching, the safety should be given priority, and for the online teaching, quality should be given as the priority. And secondly, we need to have a targeted category-based decision-making based on the COVID-19 situation, whether there is an outbreak or not an outbreak, and based on different schools, different grades, and different courses, such coordinated teaching methods which has taken into consideration of the features of offline and online, and making sure that there is an orderly transition of online and offline. And thirdly, we need to have a smooth information channel. Such information should be timely communicated to the teachers and the parents so that the students would be well prepared for such a transition of offline and online, so as they are more adaptive to such a new environment with the feature of both online and offline learning.
谢谢主持人。人民日报记者提问，请问我国这个新冠肺炎的接种情况，特别是60岁以上的老人人群，
For those who are over 60 years old, what is the vaccination?
谢谢您的提问。
Thank you for your question. Mr. Li Zhenglong is taking the question. According to the deployment of the State Council Interagency Task Force, we are guiding localities to steadily promote vaccination. As of 26th of May across the country, we have accumulatively inoculated 3,375,898,000 doses. 1,289,584,000 people have received the vaccination. 1,255,732,000 have received the complete full-course vaccination. 91.47% and 89.07% of China's total population, respectively. 774,679,000 people have got booster doses, including 36,822,000 people received the sequential vaccination. For the elderly above 60 years old, 229,553,000 people have received the vaccination. 217,609,000 people have received the full course vaccination. 86.94% and 82% among all the elder population in China, and 167,935,000 people above 60 years old have got booster doses. Vaccination has been proven effective measure to prevent the pandemic. We encourage localities to have a tailor-made approach to expand their ideas and improve, optimize the services and enhance publicity to provide more convenient quality vaccination services to all. Thank you. Next question, please. With the cover, research has shown that patients in seniority of age with complications or comorbidities and with immunodeficiency, once infected, can easily develop into severe cases. So for people at high risk, should they need extra protection? Mr. Wang Huaqing is taking the question. These people at high risk are the targets that should be protected, especially as to whether they should get extra protection. This is in the holistic plan of vaccination procedures. When we decide on the steps for the vaccination, we should consider the necessity of vaccination. Second, we should consider the immunity difference among different segments of the population. Third, we have to consider the efficacy of vaccines. When we consider all these above-mentioned aspects, all the decisions made should be based on evidence, being it safety or efficacy or the efficiency. Only by answering all these questions can we decide a good process or procedure of vaccination. While we draft the strategy of vaccination, we should consider the specific feature of the virus and also the feature of the vaccination itself. And we have to factor in the data generated in the process before we can continuously polish our vaccination strategy. And we are continuously improving our vaccination strategy to provide more targeted support and protection for people at high risk. We will take two last questions for the day. With China Youth Daily, in public places, disinfection work is ongoing, including the parks or scenic spots. How can we properly conduct the disinfection in the outdoor venues? What's the difference compared with the indoor disinfection? Mr. Zhang Liubo is taking the question. Thank you for your question. As the pandemic is ongoing in supermarkets, hotels, agricultural produce markets, schools, and transportation hubs, stations, office buildings, construction sites, and other places need preventative disinfection with a focus on the frequently touched surfaces of objects such as doorknobs, the buttons for the lifts, and the counters. These are the places which are key of our disinfection efforts. And in the scenic spots that are outdoor, the focus of our disinfection are the kiosks of the small vendors and the public toilets. And in these places, we should focus on the disinfection of the environment and the surfaces of objects, and also some gym equipments. For recreational or physical exercises services, the surfaces of these gym equipment should also be disinfected, but there is no need to disinfect the ground of outdoor environment. There is no need to have the spray disinfection of the outdoor air. All these disinfection are preventative disinfection, and the indoor disinfection is only adopted when there is a case in the family household and when this positive infected case is transferred for treatment. Based on the risk analysis, we will then decide whether we will have a thorough and complete disinfection in the domicile of the case. Such disinfection is carried out by professionals because in the indoor environment of a family, the objects and environment have a higher complication. It's more complicated, and also there's the issue of protecting personal property. It is more sensitive, and we need scrupulous efforts in carrying out such infection by professionals, and it should be decided on the specific situation of each family household. Last question. With the Red Star News, thank you, Mr. Moderator. The summer vacation is approaching. Many campuses will have their students going back home. How can the universities guide the students to have safe return to their homes and have a good pandemic control while they stay homes? Mr. Liu Peijun will take the question. Thank you for your question. The summer vacation is around the corner. Again, it will be the season when the university campus students will go back to their homes. There is a high mobility of students going back home for cross-province or cross-region travel. Having a good pandemic control for the students during the summer vacation bears on the safety and health of the students, and it also the national pandemic control is also hinged upon a good control. And the Ministry of Education has been collaborating with other departments and guided localities to have a holistic arrangement of the safe return to their homes. We support the places of the schools and also the home localities of the students to coordinate with each other and have a solid, refined service guarantee measures to ensure the orderly return to their homes, safe travel, and healthy arrival at homes. As to how can the students from universities be guided to have a good control and prevention during the summer vacation, the Ministry of Education, as of May, has organized experts to carry out study and decided on the health guidelines for students and the conduct guideline for the teachers. And these are technical guidelines based on the specific transmissibility feature of the Omicron variant and in light of the specific needs of campus and the students. And these guidelines and the codes of conduct have provided good reference to the students first. We have issued health guidelines for students. These are customized and tailor-made guidelines with categorized and targeted guidelines for students going back to their hometowns, staying on campus, put on medical observation, and hospitalized students. We've also made popular science cartoons to guide the students to abide by the pandemic response regulations in different settings. Second, we've put forward codes of conduct for students. faculty of the schools should be accountable for the campus pandemic control. Teachers and faculty are the guardians of students' health, their vanguard and their champion. They must ensure healthy, effective, and safe work to be carried out to ensure the health of the students and safety of the campus.
That we would be able to also guide the parents to have a very close coordination with the schools, and they can play an exemplary example for their children and in the COVID response. And recently, MOE have set up 3 different types of codes of conduct, and it has all priorities, but they share exactly the same common policy goals. We should all need to lead the students from all aspects so that they would be able to have a health study and health life and health growth during this exceptional time of the COVID response period. And thank you very much. We are being given an introduction of the vaccination, disinfections, as well as the campus COVID response measures. We would like to thank all these experts for answering the question from the journalist. And in the future, we will hold more of these press conferences. If you have any further questions, you can just communicate to us on a timely manner. I would like to declare the conclusion of today's